Well, welcome to the Better Breathers Club of BC. This is a program funded by the BC Lung Foundation, so many thanks to them for sponsoring this and provided to you by Poplar Pulmonary Wellness. We would like to take a moment to do a land acknowledgement. And we're coming at you today from Vancouver area. And this is the unceded ancestral territories of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And if you'd like to pop the lands on which you live, work, and play, pop that into the chat. That would be great. We like to see where people are joining us from. And as we get started, we'd like to thank you all for creating a safe space where everyone is free to share their thoughts, values, and opinions and ask questions without fear of judgment. And the information shared here is for educational purposes, and it doesn't substitute professional medical advice from your healthcare provider. And if you are looking for more things other than these monthly Better Breathers Clubs, Poplar Pulmonary Wellness also offers our clinic, our online clinic, where you can meet one-to-one with a registered respiratory therapist and certified respiratory educators for virtual appointments. And we also have our Harmonicas for Health and Happiness program, which is a 5-week program sponsored by the BC Lung Foundation. It's on Mondays at 1 o'clock, and we do have a couple more sessions opened up, one in March and one in May, I believe. So give us a shout if you'd like to join in one of those, and do reach out if you're looking for more. All of the information can be found on our website at poplarpulmonary.com. And today we would like to welcome Lisa. Lisa Ann Butcher is a registered respiratory therapist and a registered clinical counselor. So I'll give you a little bit of information about Lisa. So she's a registered clinical counselor with the BC Association of Clinical Counselors. And she's the owner and clinical director of Three Sisters Counseling, and that's in Vancouver, BC. She holds a bachelor's degree in physical education and health from the University of Toronto, a postgraduate education in respiratory therapy from the Michener Institute, also in Toronto, and a master's degree in counseling psychology from Yorkville University in New Brunswick. And about a decade ago, Lisa realized that she had a professional interest in studying mental health effects on frontline workers and those who serve others, like in a first responder role, RCMP, paramedics, nurses, physicians, RTs, and other paramedical professionals. So she has a professional subspecialty in treating frontline workers for issues like anxiety, depression, post-traumatic stress, and relationships. So now she focuses her practice on treating first responders and their families, both online and in person, to give back to them what they give to us. And
Great, thank you.
yeah, I will hand over to Lisa to take over. Thank you, Lisa, so much for joining us here today.
Thanks for having me. Okay, so welcome to our talk today. Today we're going to be talking about the idea of holistic wellness, but basically depression and mental health and how that is connected to our physical body and how we're doing as people, because there is a huge mind-body connection. So I've called this talk Holistic Wellness, Examining the Connection Between Physical and Mental Health. You can choose next slide, please. So basically, I already got an introduction there, so I won't go into this too much. I was working as a respiratory therapist for 18 years in both Ontario and BC. And about probably 10 years into my practice, I started noticing that I was quite a bit interested in how people's physical health affected everything, right? It affects their mental health, it affects their relationships. And so this is part of what that talk is about. I then went on to do a lot of mental health advocacy work and actually got a 12-session series last year called Mental Health Matters with Lisa Ann Butcher that I was sort of a YouTube type show where we talked about different matters to do with mental health. I am a professional guest lecturer. I do probably 5 talks per week. And we also offer online and in-person counseling through my company, which I started after I finished as an RT. I don't currently work as an RT anymore. We offer in-person and online sessions for mental health counseling for people across North America, specifically BC based, but anyone across North America can access counseling online. And we have two offices. One's located in Vancouver and one is located in Kelowna. And my company is called Three Sisters Counseling. So that's a little bit about me. We can head to the next slide. So the objectives of this talk are many. There is going to be quite a bit of information in here. I'm going to put up my email address at the end, so please feel free to send me an email if you have any questions, or if you have some comments or questions that we didn't get to at the end. I'm happy to answer them by email, so do not hesitate to email me afterwards if you either are shy and you don't want to speak in front of other people, or you would prefer not to. That's completely fine as well. So some of our objectives are we're going to have sort of an interactive facilitated discussion, specifically at the end. So I would encourage you to hold questions until the end or comments, unless there's something burning. If there's something burning and you really want to put your hand up, go ahead. I just find sometimes when people do that, we sort of derail into that. And then it's sort of hard if someone's not interested in that to get back to where we were. So that's why I hold it till the end generally. We're going to talk a lot about self-assessment, specifically regarding depression. We're going to discuss the mind-body connection. We're going to examine the impact of illness on our identity as people. And that's something you may or may not have thought about. We're going to talk about how to shift our perspectives out of that sort of illness behavior or feeling as though we can't do certain things sometimes. We're going to evaluate potentially our maladaptive habits. Everybody has some habits that aren't the greatest, so we want to sort of identify those. We're going to talk about getting some adaptive coping strategies for how we're feeling, and then try and connect through sharing stories. So you can change the slide, please. So some food for thought. I really like these quotations. Illness may be the greatest teacher of wholeness. And why is that? Because when something happens that affects our health, we start to contemplate what we used to have and no longer have, or what it used to be like and is different now. And so it sort of reminds us of what wholeness looked like and potentially where the parts are that we might be missing currently. Caring for myself is not self-indulgence, it is self-preservation. Now, this is an interesting one because depending on your cultural upbringing, depending on your family upbringing, you actually might completely disagree with this. So some people feel fundamentally at their core that any care put towards themselves is selfish behavior. I grew up with a European dad. He was very, I was 7 years old, get off the couch, go do some work, go to the garage, clean it up. I'd say, oh, I'm bored, Dad. Well, if you're bored, I'll give you something to do. You can empty the dishwasher, or you can do this or that. So I was kind of raised with that mindset of, don't sit down too long because you could be being productive somewhere else. A lot of us were raised that way. Some of us were raised by people who really encourage downtime. Go sit down, go relax, go take a nap. And so if you were raised in that way where giving to yourself is not considered to be self-indulgent, that actually helps you in the situation when you need to actually care for yourself. If you were raised in the way where it was sort of don't pay attention to yourself, take care of everybody else, it can feel really selfish when you're taking care of yourself when you need to. And then the third one is illness asks us to discover who we are beyond what we used to do. So a lot of us define who we are as people by what we used to do or our contribution. And so when we get ill with anything, to be honest, could be a cold, could be COPD, could be asthma, could be anything, we start to sort of look at how that's affected what we used to do. And specifically, if we're quite routine oriented, which a lot of people are, it really throws off their routine, right? Because, well, I used to go to the gym with so-and-so, and I used to go for a walk with Sally, and I used to be able to play soccer with my grandson, and I can't do that anymore. So it's about redefining our lives a little bit. Next slide, please. So my own chronic illness journey, there's a bit of a formatting issue there, but that's okay. I can read underneath it. I don't come to you specifically just as a respiratory therapist or as a mental health counselor. I also have my own chronic illness. I was diagnosed when I was 23 years old with rheumatoid arthritis. I do have a pretty severe case of rheumatoid arthritis as well as psoriatic arthritis, and I've been on immunosuppressant therapy since I was 23 and I'm 49. What was interesting about this is I got this after competing internationally for Canada in springboard diving for many years. So I sort of went from this athletic, very capable person physically to I remember the moment when I still wasn't sure what I had. And I was standing at the bottom of my stairs in my house and I was 23 years old. And I looked up, I had to go to the bathroom, and our bathroom was on the floor above me. And I just couldn't fathom how I would get up to the top of the stairs to go to the bathroom. And this had sort of come off of me competing for 10 years internationally. And all of a sudden, within several months, I couldn't fathom how I was going to walk up the stairs because my knees were so sore and I was in pain. This sort of progressed, and finally I got a hold of it and I got on good medication. But there was a huge shift in identity that happened. And what's so interesting is when I got married, my husband, who's not athletic at all, he's never done a sport. My kids grew up with the idea that he was the athletic one in the family because he, joined a bike, like a casual biking group. And he used to go play golf with his friends. And they were like, oh, dad's so athletic. It's nice how dad does sports. And I remember thinking in that moment, wow, my identity has really shifted because that would have really bothered me before, that he was seen as the athlete in the family when he was the farthest thing from it. And so it really showed me all the work that I had done. And when I first got diagnosed, I remember really being fixated on finding a cure, sort of like, well, yesterday I was fine. And now today I'm not. And all these things are going on. So surely there must be something I can do to reverse time or to fix this somehow. And after much soul searching and much searching, I remember my doctor saying, I admire your quest for a cure, but I've been doing this for 35 years and I can assure you there is not one. But there are things you can do to make your life easier. And sure enough, all these years later, 25 plus years later, I live a very fulfilling life. But I would say I have learned to thrive with illness as opposed to just survive. Um, I put the word DABDA there. And what that means is when we're diagnosed with something, whether it's COPD, asthma, any type of, let's say, restrictive lung disease, what happens is we initially go through the stages of grief, right? So D is denial. Well, this can't be right. I mean, I was fine yesterday and all of a sudden I'm not. So we're in denial. Then we go to anger and we think this isn't fair. This person doesn't have this and I didn't have this before and now I have it. Then we go through bargaining. Well, maybe if I just eat better, maybe if I just stop smoking, maybe if I just eat organically, maybe if I just get better sleep, I can fix this. Then we hit the depression stage, which is kind of that precursor to acceptance, where we start to think, this is really not great. This is not what I chose. This is not what I planned. This is affecting me in a negative way. And that can really play on our mind. And that's actually a very common thing that happens to most of us. We all go through the stages of grief. And if anyone has ever lost anyone, a family member or a friend, you'll notice you've done the same thing. It's denial. You can't believe they're gone. It's anger. That's so not fair. They didn't deserve that. There's bargaining. Well, what if this? What if that? Maybe we could do something. Then there's depression, and then there's acceptance. Um, I would say after acceptance comes that journey towards resilience. And we do that through gathering knowledge and looking to I guess just better ourselves in the way that we can find a way to cope that feels good for us. Okay. There's a book I read that I'm going to talk about later, and it's why I put DPE book. David Patchell Evans is the founder of the Good Life Fitness Clubs, if you've ever heard of that before. He actually has an interesting story in that he competed internationally in the Olympics, actually, as a rower, and then got diagnosed, similar to me, with rheumatoid arthritis. He found himself all of a sudden not able to do anything, not able to, really struggling with his mental health as well as his physical health. And he wrote this book Living the Good Life by David Patchell Evans. And in it, he actually says something that really stuck in my mind that I'm going to touch on later as well, where he says, don't let the things you can't do stop you from doing the things you can. And I think that's something that really gets us out of that feeling of depression or low mood. Next slide, please. So why I went from being an RT to an RCC, we've already talked about RT being respiratory therapist, RCC being registered clinical counselor, is I was really fascinated in watching people who were struggling with their physical health and how that impacted not just them and their physical health, but how it impacted their mood, their mental health, their sort of motivation to keep going. And just their frustration with the whole situation and how that actually trickled down throughout the family. I would see mothers very affected by their children who were sick. I would see spouses very affected by their spouse who was sick. I would see the spouse, quite often men, who were used to being that, I'll go do it. I'm going to work. I'll go get the thing from the car. Don't lift that. I'll do it for you. And then all of a sudden they were struggling, and it's a real shift in identity. So I began to study and focus on how I can holistically help people redefine their capability and their identity in the face of illness. Next slide, please. Our identity, where does that come from? So it actually develops through our experiences, our relationships, our biology. So that's like our physiology. The reason it develops through our experiences is because what happens throughout our life is we try things, and in trying those things, we often succeed at them. And so our successes fuel our identity. You become sort of you know yourself a bit differently. I'm good at baseball. I'm good at this. I'm an excellent cook. You know that because you've tried things and you've been successful at them. So that forms part of your identity. Anybody who has an identity that you're really good at cooking or you're an excellent caregiver, it's important to you that you're able to caregive and you're able to cook for people if that's how you form your identity. If your identity is formed to something physical and then an illness or issue prevents you from doing that, it can affect your identity, which leads to a connection between poor mental health. Now, this doesn't mean we have a mental health disorder. It just could mean that maybe we're struggling with our mental health in that moment. Okay. It could be maybe we're struggling with it for several months, maybe several years. It doesn't mean that we have a diagnosable disorder necessarily, but we can have different levels on the spectrum of, let's say, anxiety or depression. Okay. Our identity is our sense of who we are as people. It's how we understand ourselves to be. It is our values, it is our roles, and it's basically our known place in the world. Okay. And this is how illness really affects our identity, is that it actually makes us question what place we have in the world. And I'll give you an example of that. My stepdad just got diagnosed with cancer and he's been going through treatment. And he's sort of he's the guy who you could ask anything mathematical and he knows the answer right away. I've long asked him, what's 20% of this? What's 28% of that? What's 7,000 minus whatever? It doesn't matter what you ask him. He knows the answer and he knows it really quickly. But interestingly, the type of cancer he has, it causes him to have a bit of confusion. And so he's not able to answer anymore. And it's really affected his mental health because that's what he prides himself on. He's what's it called? Aeronautical engineer. Like he's very, obviously very math oriented. And it really has affected him that way. So his place in the world is sort of unknown to us right now. And he feels like it's unknown because he's had that effect from his cancer. Next slide, please. So how does physical illness affect our mental health? So obviously there's that mind-body connection. And I have a couple of really tangible examples later in the talk that I think will be quite interesting to you. But basically, impaired health does challenge our sense of self, as I've said. It does affect our identity. It causes us to question our worth. It makes us contemplate our ability to contribute. It forces us to adapt. It impacts our mood and motivation. And it affects our ability to work, sleep, eat, and in this case, when we're talking about pulmonary things, breathe. I know as a respiratory therapist, and I worked as a respiratory therapist for many, many years, almost 2 decades, that not being able to breathe or struggling with breath uh, is a very stressful thing. Um, Interestingly, whether you've just had pneumonia before and it's affected your breath, or you're struggling with long-term COPD or a restrictive lung disease of some type, it really makes you feel like you've lost control or that you could lose control because you have to be careful with what you do. You don't want to exacerbate it. Every time you exacerbate it, and I know this to be true from watching every patient I've ever helped, is they're very hesitant to kind of get themselves to that point where they're kind of out of breath a little bit because sometimes it can take a long time for you to catch your breath again, as opposed to prior to having this issue, you kind of came back to it quicker. So I think people are really hesitant. So it does affect our ability to obviously do all those things: work, sleep, eat, breathe. It also, on the positive side, encourages us to redefine everything, right? Ourselves, our lives, our capabilities, our support systems, our expectations, and our goals. Okay. I think shifting expectations and perspective is a super important part of managing mental health, especially in the face of physical health. Um, it's often our expectations which are the detriment to us. You know, it's kind of what we put on ourselves. It's not what others put on us, it's what we put on ourselves. And we often compare ourselves to what we were before, and that can be something that is helpful to redefine in the face of illness. Next slide, please. So, what is depression? There's different ways that it shows up, okay? And people will often ask me, how do I know if I have depression? As opposed to just say a low mood, or where is it on the spectrum? So there's three different ways that depression can show up for you. So there can be the emotional side of it. Now, this is a spectrum, and I always do this when I say spectrum, because this would be like diagnosable, really struggling, ongoing for many weeks or months uh, depression. And then there is low mood, which may or may not be sustained. Everyone can generally say that they've had sort of those times where, for 1 or 2 days, or a few hours, or less than a week, they kind of feel sad. That would be low on that spectrum. And I'm going to give you a little test you guys can do at the end, and a little link to it so that you can check if you have depression or not. Okay. So, emotional symptoms of depression would be feeling sad, feeling like this feeling of emptiness, feeling a bit numb, feeling maybe tearful, having a loss of interest in things, feeling a touch of hopelessness all the way to a lot of hopelessness, and then also guilt, especially if you were raised in an environment where emotions were not encouraged to be talked about. This is also often generational. Um, you know, now everybody's talking about mental health, and I think that's really important. But in my dad's generation and in my grandfather's generation, I mean, I would argue my dad was depressed for 30, 40 years. He just never said anything. So I think that's not the way we're going now. And I think it's great we're talking about these things. But there is emotional symptoms of depression that we shouldn't ignore. We don't have to dwell in them, but we shouldn't ignore them. There's also mental parts to depression, which would be difficulty concentrating, difficulty making decisions, a lot of self criticism, having low mood or motivation. Now, interestingly, you could also be anxious because anxiety, or different spectrums of that, so everything from low anxiety to high anxiety, also causes difficulty concentrating, difficulty making decisions, self criticism. So that's something to be mindful of as well. Then there are physical symptoms of depression, which would be low energy, change in sleep patterns, substance use or abuse, change in appetite or weight, and then aches and pains or fatigue. Now, actually, one thing to say about that, about the aches and pains and fatigue, you actually will notice when you're struggling with your mental health, or you have a lower mood or lower motivation, aches and pains actually exacerbate themselves. And it's not to say you don't have it, it's just that you notice it more. So I'll give you an example of that. If you had an ache and pain because you kind of tripped a little bit coming down the stairs and bashed your knee on the side of the stairs, okay? Like let's say on the railing. You would really notice that ache and that pain if you had nothing to do all day and you were staying at home and it was raining outside, okay? If your grandkids were coming over and it was someone's birthday, you would notice it less. And the difference there is not actually the pain level. You still have the same level of pain, but you're distracted, right? One is with family, connecting with people. You have something to do, you have something to look forward to. The other one is you don't have anything to look forward to. You're just sitting in silence with yourself. And so aches and pains can be exacerbated. And this can be a sign of depression if you find aches and pains is something you really fixate on. It could be that your mood is sitting quite low, and so it's more prevalent or noticeable to you. Next slide, please. So, how do I know if I'm depressed or just down? Okay, this is an important one. Ask yourself if you're doing all the things. Okay, so the things would be, are you waking up at a normal time in the morning as opposed to sleeping in quite late? Okay. Oftentimes, when we sleep in quite late, we will actually shift ourselves into a lower mood. And I'll give you an example of that. I had surgery several years ago for my arthritis. I had my elbow done and I had to take medication, painkillers, and it sort of kicked me into this weird sleeping pattern where I was staying up until 2 o'clock in the morning and then I was sleeping in until noon the next day. And it only took about 3 days of doing that before I actually started to feel depressed. And I personally have not struggled with depression. I would say I'm definitely on the anxious side if we're talking about things. But I've not personally struggled with depression, whereas my brother has struggled quite a bit with depression and is never anxious. So we're kind of opposite that way. Um, if you're doing things like that, like staying up very late and then sleeping in quite late the next day, that would be something that's increasing your low mood, meaning making it worse. Okay. So part of the things you should be doing would be setting your alarm in the morning and waking up at a normal time, just so that you're not pushing yourself into that low mood danger zone. Another thing that would be considered all the things to help with depression would be making sure you have lots of light in your house. One of the first signs I see in people who have depression who come into my office is they'll tell me that they keep the blinds drawn all day. They don't get any natural sunlight. They don't really go outside. As soon as you do that, you're actually increasing your chance of having a low mood. So none of these things are catastrophic, but you want to think about how each of them contributes minutely to our mood. So keeping the blinds drawn, sleeping in too late, all the things that we're doing make it worse. Okay. So ask yourself if you're doing all the things. Are you opening the blinds? Are you waking up on time? Are you avoiding alcohol? Are you connecting with people? And we're going to go into all those specifics. But if you're doing all the things and you still feel like you're treading water in the deep end and you can barely keep your head above water, I would say you could call yourself shifting more into the depressed side as opposed to the just down side. Okay. If we're just down, picture yourself standing in the shallow end of a pool. The water's down to your waist. You can still breathe okay. You're not particularly stressed. Someone might be splashing in the shallow end, which is a little bit concerning because you don't really want to get wet. So you start to get a little bit more uncomfortable, but it's still manageable. That would be the feeling down feeling. Okay. So you might have 1 or 2 days, you feel a little bit less motivated, but you're not falling into that deep end where you're trying your best to survive. Okay. You want to ask yourself, how am I keeping up with my ADLs, which is activities of daily living? That's just the general day-to-day stuff. Are you making food for yourself? Are you bathing? Are you washing your face? Are you brushing your teeth? Are you calling a family member or friend? Are you being relatively social, or are you conversely retreating, not talking to anyone, avoiding making food, engaging in behaviors that don't help you feel better? And that's how you would determine which end of the spectrum you're on. Next slide, please. So here's how we assess, and I want you guys to think about this. This would be how we assess ourselves on a daily basis to determine our mood. Um, let's say, for example, you are struggling particularly with your pulmonary health. Okay. So your lungs are not doing great. Maybe it's winter. Maybe you just got sick. Maybe you just had a treatment. Maybe you ran out of medication. All these things can contribute to how we feel. Maybe you're stressed. Okay. You want to do a daily self assessment. So initially, there's something called the Beck Depression Inventory, and I'm going to give you a link to that at the end of this, and you guys can go on afterwards. It's a 21 question questionnaire. It'll give you a scoring system, and you'll be able to tell what your score is. If your score is on the high side, I would say it's worth mentioning to your doctor, hey, I did a Beck Depression Inventory, and interestingly, I actually have quite a high score. The doctor might say, okay, well, why don't you try and do the things? Okay. Get outside, connect with people, open your blinds, get good sleep, avoid substances, and then let's reconvene in a month and let's see what your Beck Depression Inventory scale is. If it's the same, then they look at, okay, is this maybe a chronic depression or something that's been longer standing? Or is it related to your health? And as your health improves slightly, depending on the time of year, you might feel a little bit better. Some people are very affected in winter just by depression and generally just because of the sort of low light and things. Other people start to feel better in the springtime when the sun comes out. Ask yourself on a scale of 1 to 10 each morning how you feel. If you were to quantify your depression or your mood out of 10, 10 being you're super excited, you've never been this excited, you just won the lottery. Okay, that would be 10. And then 1 would be you feel completely down in the dumps. You don't want to see anybody. You don't want to talk to anybody. Okay. So asking yourself where you are when you wake up in the morning, or how do you feel at the end of the day? And what this does is this allows you to kind of assess your own day. What triggers you? Okay. Did you wake up and you felt like 7 out of 10 happy? And then all of a sudden by lunch, you're at a 2? Why is that? Is that because something happened with somebody? Is that because your health changed? Is that because you're tired and you need a nap? Trying to figure out what triggers you to have a change in mood. Ask yourself what brings you up. Okay. So if you're feeling low mood oriented, what improves that? If you will, what puts gas in your tank? Okay. I like to think of it that way. If you're feeling kind of low in terms of energy or mood, what are the things that make you happy? Everybody needs kind of 10 things in a toolbox to make them feel happy. It's going to be different for everybody. And for me, for example, I really like doing my nails. That makes me feel happy. I also like to go for a walk with my dog. That makes me feel happy. Um, hanging out with my kids makes me feel happy. Watching a show by myself makes me feel happy. Making a good meal makes me feel happy. So for you guys, it's going to be different. Um, where am I here? Ask yourself if you're angry, sad, frustrated, hopeless, tired, or conversely, do you feel hopeful, thankful, comfortable, rested? Now, here's an interesting thought, and this may or may not apply to you. We weren't raised generally by people who taught us about our feelings. I don't know about you guys. I definitely wasn't with my European father and mother, who were not at all interested in hearing about feelings. They were more interested in just, what am I doing? Get something done with your day. Um, how we raise kids in general is something like they'll say, when they're a baby, they'll point to something and we'll say, oh, do you want the apple? Mommy will go get the apple for you. So the first thing that your child learns is what an apple is, right? That's one of the first words we have actually is ball, apple. And the reason is because that's what our parents did. They helped us identify objects. That was their contribution. What we want to do ideally is help kids identify their feelings. And this creates adults that are very in touch with their feelings and how they're feeling. Now, I would argue many adults are not. You'll ask a lot of adults how they feel, and this could be in the context of their marriage or just their life. And you'll say, well, how do you feel? And they'll go, I don't know. Or they'll say, why are you mad? I don't know. And they don't really know because they've never really thought about it. They don't know if they're frustrated. They don't know if they're mad. They don't know if they're angry. They don't know if they're tired. They're not really sure because they've never really stopped to think about what their feelings are. So I encourage you to actually start paying attention to your feelings. What is this feeling? Is it defeat? Is it that it's not fair? Is it that I'm overwhelmed? And trying to play around with those feelings. Okay. An exercise in self-exploration to understand yourself a little bit better. Ask yourself what your coping mechanisms are and flip to the next slide and we can talk a little bit about that. So maladaptive coping mechanisms. Now, this might not resonate with you at all. And then some of you might go, yep, I totally get it. So some of the things we do that are, quote, maladaptive. So this would be negative. Maladaptive would be we've chosen something that is negative or not healthy or not helpful to our health. Okay. We all have some of these. Okay. Some of it is substance use. How many people do you know, or maybe you yourself, who you have a super stressful day or a super long day, and the first thing you want to do is grab a glass of wine or a beer? Lots of people want to do that. Okay. Lots of us have grown up that way. That would be, though, a maladaptive coping mechanism. Now, it's not to say that you can't ever have a glass of wine or a beer, but what I would encourage you to do if this is something you do is don't pair your glass of wine or beer with depression or anxiety. Okay. So if you have a really long day, you're super stressed out, you're 9 out of 10 stressed, or 1 out of 10 low mood, don't come home and crack a beer or open a bottle of wine, because what you're doing there, for any of you who remember Pavlov's dog, do you remember Pavlov's dog where there's the dog and the steak, and then the dog starts salivating for the steak, and then they ring the bell at the same time, so eventually the dog salivates to the bell? That's what you're doing with wine and beer, right? I've had a crazy busy day. My God, could I use a glass of wine right now? I open a bottle of wine, I have a glass of wine. All of a sudden, I've told my brain that as soon as I get massively stressed, the first thing that I need is a glass of wine. So you actually end up pairing that. So if this is something you've historically done, I encourage you to switch it around. And you can do this at any time, actually. It doesn't matter what age you are. You can be really low mood or really stressed out, feel like a beer or a glass of wine. Do 3 things that decrease that feeling. So 3 things to calm yourself down: shower, make a nice meal, call someone, journal, something like that. If you're low mood, do 3 things to elevate your mood: go for a walk, call someone, take a nap, make some food, whatever it is. Once your mood comes up to a normal level where you're not feeling super low anymore, or once your anxiety comes down to a point where you're not super stressed, please go ahead and have a glass of wine or a beer, because now you haven't paired it. Okay. Same thing with smoking, right? I grew up in a smoking household. There were no windows open. People would light cigarettes at the dinner table. That's how I grew up. And they did that because they had very high stress jobs and they grew up smoking. That's something that obviously is maladaptive because it doesn't help our health to do that. It helps us in the way that it makes us maybe less anxious, but actually overall, as you've learned probably through your education, both drinking and smoking actually increase anxiety and decrease mood, but initially they don't. So initially we're like, this is awesome. And then we're like, this is not great anymore. So it's sort of that initial part that we like and then not the rest. Procrastination, too much TV, avoidance of sleep or excessive sleep, staying up late, and then avoidance in terms of social interaction is another thing that we do maladaptively. Next slide. Adaptive coping strategies. Here's where we want to be. Okay. So these are the things that improve our mood and decrease anxiety. Okay. So walks, fresh air, time in green space. And there's a picture of someone in green space because a lot of people don't know what that is. It's actually a proven treatment for depression to spend more time in green space, meaning around you is there green. Okay. It doesn't really necessarily mean a green wall behind you, but it means just outdoors in nature. Okay. So even if you have a balcony and you're living in an apartment and you have a little garden there with some basil and a little plant, it's green space. Okay. If you live near a forest, you can go for a walk. If you live near a park, walk across the street to the park, sit in the park, have a coffee, walk back home. Okay. Open the blinds, like I talked to you before about. Set your alarm clock to wake up the same time every day. There's some really great research, whether you like him or not. Dr. Jordan Peterson, who's very famous, obviously, all over the internet. And one of the things he talks about, and it's actually super interesting because it's true, is that he advocates for setting your alarm for the same time in the morning to wake up, because actually creating a routine kicks you out of depression oftentimes. He knows this specifically because his daughter suffers with debilitating depression. So he's done a lot of work on it. And it actually, interestingly, my brother has quite bad depression, and that was the first thing the psychiatrist told him, was to set his alarm for the same time in the morning. So if you're struggling with your mood, just pick a time and always wake up at that time. No matter what time you fall asleep the night before, always wake up at that time and see if it shifts your mood. That would be an interesting experiment. Eat properly, create a routine. I happen to hate routines. I'm not a routine oriented person. My husband is so routine oriented. I always make a joke that I could have him killed if I wanted to, because he does the same thing every day. I know where he is at all times and exactly what he's doing at every moment of the day because he does the same thing. I don't have a system for anything, and I wish I did. So routine is not my favorite thing, but creating a routine actually does improve mood if you are someone who's struggling with depression. Avoiding substances, connecting with people, and then journaling. And if journaling is something that you're not familiar with, or you think is sort of ridiculous, or you think, I don't know if I'd like that, I do encourage you to try. And a really good way of doing it is you don't have to write a big paragraph or a big letter to someone or anything like that. You can just get a little book and you can just journal how you're feeling. So jot a few feelings at the top. You can jot down what you would like to be different. You could say, I wish this. So I feel this. I wish this. And that can be enough to let you know how you're feeling and what you're actually wanting. Okay. Next slide, please. So mind-body connection, there's two examples of how the mind and body are connected. There's an interesting study where patients were given, a very large number of patients actually, were given a medication to increase the immune system, meaning cause sort of havoc in the immune system where it was sort of in fight or flight. So basically mimicking when we're sick or we're struggling with our health and our immune system flares up. It actually equaled depression. So when they got meds to increase or activate their immune system, their mood naturally dropped. They experienced fatigue. They had a loss of interest in some things, and slow thinking followed. And they had no history of depression previously. What this shows is that biological changes in the body can actually produce depression. What's interesting about my arthritis that I would say I could bolster this in terms of its correctness, let's say, when my arthritis is flared, which doesn't happen often, but it sometimes does, and that's my immune system flaring it because rheumatoid arthritis is an immune-based disease. I get super anxious, and I would say I have a lower mood. So that's an interesting thing to think about. The other thing is illness behavior. So people have different illness behavior, and I'll give you an example of this. I have three girls. I'm a mother to three girls. They are 17, 15, and 13. My oldest two are very different than my youngest. My oldest one is quite dramatic if she's sick. But she still gets over things quite easily and will push through things. My middle one wouldn't mention she was sick if her life depended on it. She's the kind of person, if she ever says she's sick, I would immediately take her to the hospital or doctor because she never talks about any illness or sickness. My youngest is literally like it is the worst day of her life every single day if she's sick. So illness behavior is very different for all three of them. My youngest constantly complains about feeling sick, and she's rarely sick. My middle would never complain about it. And then my oldest one kind of will complain about it, but push through it. So think about your own illness behavior. Illness behavior is a psychological concept that basically describes how people perceive, interpret, and respond to symptoms of illness. Now, if you're someone who's prided yourself on never being sick, on being very independent, on always being healthy, it's probably very difficult for you to struggle with anything, whether it's a cold, whether it's the flu, whether it's COPD, whether it's asthma, it doesn't matter. You probably may have struggled with it. Now, if you are not the kind of person who prided yourself on that and you're more adaptable, you may be doing quite well with it. And you've sort of adapted your illness behavior because you're sort of focusing on the resilience part of it. Um, Basically, illness behavior describes how we think, feel, and act when we feel unwell. And it determines how we will respond to illness influences. And how illness influences us is it actually influences our ability to recover. Um, our illness behavior influences our ability to recover. It influences our relationships and our mental health. So let's take, and I don't know how any of you are, but let's just say someone on here has very pronounced illness behavior. It's very hard for them to deal with illness. They struggle with it, and it could be for a variety of reasons. It could be maybe they don't have much support. Maybe they've never really felt that cared about by people. Maybe their pain tolerance is not very high. Maybe they've actually experienced a ton of pain in their life and they are so sick and tired of it, which is why they're not handling it very well, because they feel like they've kind of experienced enough in their life and they just want to enjoy now their retirement, and now they can't because they're ill. This can affect our relationships, right? Because if you're married to someone or you're living with someone who doesn't subscribe to that same thought, they can judge you. It can influence your mental health, which can then in turn increase your or impair your recovery or your ability to recover. So next slide, please. So what I like to do is teach people about shifting perspective. So if we go back to that thought about David Patrill Evans, don't let the things you can't do stop you from doing the things you can. I know with chronic illness for myself, and mine's pain-based, I understand. My plans for the day are often uprooted. That is the most frustrating thing for me about chronic illness, is that I have it in my mind what I'm going to do. I'm going to work out tomorrow, or I'm going to go do this, or I'm going to go do that. And then I wake up and I am in pain and I can't do that thing that I had prepared for myself that I was going to do. That I find very frustrating. So I think the statement, don't let the things you can't do stop you from doing the things you can, is important. And how I've integrated this into my life and how I like to teach patients to integrate it into their life is no matter what you had planned, even if you can't do the thing that you had planned, find something that you can do. Okay. So that you're coming from a place of control and of redirecting your focus or shifting your perspective or altering the terms of the game in order to still win. Okay. If you come from a place of, I have this planned and I can't do it, you're going to live your life in a state of defeat. Okay. And it's going to play with your mental health because you're going to feel like I'm never winning. This is not fair. Why can't I do the things that I planned or that so and so is doing? The other thing that's really important is not to compare yourself to other people. I know if you start comparing yourself to people that are, let's say, your age, but they aren't struggling with the same things, then it can be very hard. My mom actually did this the other day. My mom's actually quite healthy. She's 78. She's got problems. She's got Crohn's disease. She's got autoimmune disease, which is where I got it from, obviously. But realistically, she still golfs 3 days a week. She actually, arguably, I think, is healthier than I am in many ways because there's no way I could golf 3 days in a week. But she compares herself because she has these two really fit friends that actually are just lucky genetically. They've just not really, they haven't done anything different than my mom. My mom was always fit when she was younger. But genetically, they've just kind of won the lottery a little bit in the way that they're in their early 80s and they're still, one friend of hers is still cross-country skiing. I mean, I find that incredible. I don't think I could cross-country ski now, and I'm 49, but she still cross-country skis and she's 81 years old. My mom was comparing herself to her the other day, saying, well, I just think it's it's so unfair that Monique can do this. And I said, Mom, there's people who are younger than you that are unable to leave the house, or they're in a wheelchair, or they can't breathe, or they're, like they don't have family around. And and even those people there's still things to look forward to and be happy for and all those things. So I think it's really important not to compare yourself to others, because I don't think that's helpful for your mindset. Um, Focus on giving to yourself. Focus on pacing yourself. Like I used to say to the people I would see for walk tests, and we would check for their oxygen and things like that. I would tell them where we're going to walk, and I would say we're going to walk from here to there. But I would actually put 2 chairs between here and there, just in case. And it would actually make them feel better. And the funny thing is oftentimes they wouldn't even need them, but just the idea that they were shortening the goal to a manageable thing was really good for their mindset. So I would say, don't focus on the whole length. If I tell you you're going to walk all the way down and then back, that feels really hard. Same way as if I told someone, let's go run a marathon, people are going to say, I can't do that. But if you break it down into manageable goals, we're going to walk from here to that chair, and then you can decide. Or we're going to run 1 mile instead of 26. That's a manageable goal. Okay. Focus on 1% better. So, 1% better is important in the way that oftentimes we have this goal that's way up here and it's actually just too high. So if we're here and we're at the bottom of the mountain, we're kind of somewhere in the middle and we want to get to here. If this is our only goal and this is our only measure of success, guess what's happening every single day as we're trying to get here? We're actually failing, right? Even though we're progressing, this is our only goal and our only measure of success. So if we're here and we're actively working towards getting it, we're going to naturally feel like we haven't done enough because we're not at the only goal we've set. So what you want to do is you want to set these little goals in between so that each day you're winning. Okay. So set a goal. Today I don't feel very well, but you know what I am going to do today is I'm going to wash my hair. Or today I don't feel very well, and I was going to go to the apple orchard with my daughter and my granddaughter, but I don't think I can do that anymore. But what I will do is I will ask them to pick me up on their way home, and we can go for apple cider and then come home. Okay. So you're going to find different things that you can do. So focusing on that 1% better than you think you can do. Okay. You want to focus on that journey and not on the only outcome that there is. If we only set one goal, we're going to feel like we're not doing enough or we're not capable. Okay, next slide.
And I'll just let you know we're close to the hour, but I think we'll be okay.
Yeah, I've got my phone here. We're almost
Yeah.
done. Yeah.
Yeah.
So it's important to practice self-assessment, practice self-compassion, practice self-forgiveness, practice self-advocacy, practice self-love. Next slide. Okay, you want to foster your own personal resilience. So it's important because there is a mind body connection that you feel like you're giving yourself a purpose by focusing on your own resilience. Okay. So our resilience allows us to establish a sense of control. It's like telling yourself, I'm not going to let this stop me because I'm going to find the thing to do that I can. Okay. It reminds us that we don't have to let things we can't control stop us from doing the things we can. And it allows us to find ways to problem solve, to propel us forward, and help us move from that like barely surviving, where we're trying to just keep our head above water, to actually thriving. Okay. Next slide. So this is the end of our talk. I did have a slide in here just about chatting about resilience or experiences with either depression or resilience or identity or mind-body connection. And I do have, we started a bit late, like 5 minutes later, so I do have time to stay if anybody wants to ask a question or share anything. And no problem if you don't. My on the next slide, and perhaps Tina can share it with all of you guys. The resource. Oh, sorry, my dog's barking. I apologize.
We don't hear it. You're good.
Okay. Hang on, sorry about that. Let me just stop for 1 second.
We can't hear it. Yes, we'll
Sorry
post
about
in the
that. Yeah.
we can post in the popular community the information for sure.
If you
Yeah.
can, yeah. And
Yeah.
the Beck Depression Inventory, that test I was telling you about, is right here. So it's bditest.org. So if you go to this, and if for some reason that link is not working for you very well, you can just Google Beck Depression Inventory free. And then it's a 21 question test. And it's a good little baseline, right? You can do it for yourself and see what you come up with. If it's low, great. If it's high, something to be mindful of and potentially talk to your doctor about. Does anybody have any questions?
Amazing. Yeah, we'll bring it. We'll just finish through the slideshow and then we can stop the recording and have some wonderful sort of personal chat and sharing.
Awesome.
So thank you so much. I'll post a Google review link in the chat in a moment here. Our next meeting is coming up on February 11th, also at 2 p.m. if you'd like to join us for that one. I think we're talking about breathing techniques. So it's a good one with Jenna. Yeah, Jenna's talking about breathing techniques. So thank you so much, everybody, for joining us. Lisa, that was amazing. I cannot believe how much information you packed in there.
Oh, good. Okay. And actually, I don't mind, guys. You know what? To be honest, Tina, you have that slideshow. So if anybody wants that, please feel free to send it to them.
Okay.
Because it might be nice if someone wants to go through it and just kind of remind themselves of things. I think that might be helpful for people too.
Amazing. Yes, we are
Mhm.
happy to share that. So just reach out. We're Poplar at poplarpulmonary.com. And we have a question in the chat. Alan, oh yeah, Alan says, great session, but he's got to go. Thanks for all the
Okay.
information. Thanks for joining us, Alan. It was good to see you. Take care.